Hi, hello. I'm going to go ahead and get started shortly.
Okay.
Awesome. Thank you.
How you doing
Doing
today,
well,
sir?
thank you. And yourself?
Yes. All right. I'm Joe Cooper.
Awesome. I'm Mark Lockwood. Hang on just a second, okay?
All right.
Can everyone see the screen?
Huh?
I just want to confirm, can everyone see my presentation slide?
I don't. I'm just on the phone part. I'm not on. I'm not FaceTiming. Do we have to FaceTime it?
No, not at all. Okay, I'm going to go ahead and get started now. Just for time's sake. Good afternoon, everyone. I asked before I present if everyone can their phones. Thank you. Good afternoon. My name is Mark Lockwood. I'm the Harm Reduction Programs Manager here at the Center for Harm Reduction Services. I wanted to take time today and say thank you all for attending our fentanyl test strips webinar of the training of trainers, which the intended audience as listed is for opioid treatment programs and buprenorphine providers. The purpose of today's webinar is going to be one, to discuss the opportunity to obtain fentanyl test strips through the Center for Harm Reduction Services, as well as to also prepare opioid treatment programs to disseminate and train individuals on how to use fentanyl testing strips as a means of an overdose prevention tool. As far as introductions go, I asked, as listed here, to please enter the following in the chat box that we have. One, you all, if you can, to enter your name. Two, to enter the entity in which you represent. And lastly, if you can, to enter the type of CEUs you are requesting from this training, if applicable. This is also just for our record keeping of who all was listed on this call as well. Again, if you can just enter your name, the entity in which you represent, as well as the type of CEU you are requesting from this training. Before we go ahead and jumpstart into the presentation, it's actually twofold. So I'm myself and my colleague Allison are gonna talk about the work that we do here at the Center for Harm Reduction Services, as well as laying the foundation for fentanyl test strips. And then we're gonna have a second part training from Mira Corey, who's going to talk about fentanyl test strips and doing the training of trainers. So a little bit of background information about the Center for Harm Reduction Services. We were established in February 2019, which was just last year, to centralize harm reduction activities from different parts of the department. We're housed within the Infectious Disease and Prevention and Health Services Bureau within the Prevention and Health Promotion Administration. And some of the major activities that we do within the center, we have workforce development and training, which also includes our grounding, our response. We also have our syringe services program, or also known as the SSPs. We have our overdose response program, which works primarily on naloxone training and education and dispensing. And then we also do naloxone purchasing and distribution, as well as providing harm reduction, general harm reduction grants through our access program. We are currently a small unit, as you see here. We are a team of 9 individuals within the Center for Harm Reduction Services. So as part of PIPA, which is the Prevention and Health Promotion Administration, we have our mission and vision here. And our mission within PIPA is the mission of Prevention and Health Promotion to protect, promote, and improve the health and well-being of all Marylanders and their families through the provision of public health leadership and through community-based public health efforts, partnership with local health departments, providers, community-based organizations, and public sector agencies, giving special attention to at-risk and vulnerable populations. And then our vision is Health Promotion Administration, and Visions of Future, in which all Marylanders and their families enjoy optimal health and well-being. And so here at the Center for Harm Reduction Services, we really work effortlessly to ensure that all of our harm reduction activities, as well as our vision and our strategic goals, are in alignment with that. And so here at the Center for Harm Reduction Services, we envision a Maryland where, one, healthcare and social service systems meet the needs of people who use drugs in a comprehensive, community-based manner. Two, people who use drugs have equitable access to high-quality care. And three, that services provided to people who use drugs are ultimately free from stigma and discrimination. And our strategic goal this fiscal year is to reduce substance-related morbidity and mortality by optimizing services for people who use drugs. I wanted to note today and take a moment to parse through this, but today is August 31st, which is also known as International Overdose Awareness Day. And so I think it's just, important to carry out this work and also just think about what does it mean to raise awareness around overdose, as well as reducing overdose deaths, not only statewide or within our nation, but also internationally. And so it's only right that we also host this webinar on this day as well. And now I'm going to actually hand it over to my colleague, Allison Thompson, who will lead us into the rest of our webinar. Thank you.
Hi, everyone. Thank you, Mark. I just wanted to go over a quick agenda for today's webinar. So I'm going to just go over a brief history of the center's evaluation of fentanyl test strips, as well as just some, needs-based information about why we're distributing fentanyl test strips to OTBs. And then I'm going to hand it off to MaHRTI, who is going to do who is from the Maryland Harm Reduction Training Institute, who will present the training of trainers. And then we'll leave some time at the end for a questions and answers. So first, I want to provide an evidence base for the distribution of fentanyl test strips. A study in Rhode Island found that a positive fentanyl test strip result led to self-reported behavior change among young adults 18 to 24. A study in Greensboro, North Carolina, found that the use of fentanyl test strips was associated with changes in drug use behavior and increased perceived overdose safety. And they also found that individuals who encountered a positive fentanyl test strip result were had 5 times the odds of reporting changes in drug use behavior. And then finally, I wanted to mention the Forecast study, which was completed by Johns Hopkins Bloomberg School of Public Health, and it found that 84% of participants were concerned about fentanyl and believe that drug checking would help protect themselves from overdose. Next slide, please. So next, I want to go into the center's evaluation of fentanyl test strips. So in the second half of 2019, the center conducted an evaluation in which we gave overdose response programs fentanyl test strips to distribute to people who use drugs. These overdose response programs distributed fentanyl test strips through many outlets, including outreach events, mobile units, syringe service programs, treatment facilities, and medication-assisted treatment programs. Overdose response programs were asked, once they received the strips, to get individuals who were given fentanyl test strips to complete an evaluation survey. And upon analysis of the evaluation surveys, we found that over 90% of individuals who encountered a positive fentanyl test strip result changed their behavior to implement an overdose risk reduction strategy. And these strategies included either throwing the drugs out, using less, doing a tester shot, using drugs more slowly, using drugs with others rather than alone, and having naloxone on hand when using. And it also found, I thought this was notable, the evaluation also found that over 90% of participants that stated a preference for fentanyl, because that was one of the questions, was whether they had a preference for fentanyl, also reported a behavior change to reduce overdose risk. Next slide, please. So to understand the need of drug checking and fentanyl test strips, we must first understand the complex needs of people who use drugs, which I'm sure everyone on here has much experience in this. This diagram gives examples of needs that may need to be addressed for people who use drugs, and us at the center, we encourage and support comprehensive services and a holistic approach to address these needs. So for example, in an OTP setting, someone could be enrolling in treatment to obtain methadone or Suboxone. However, upon further evaluation, you assess this person is now in need of mental health services, Hep C treatment, housing support, drug checking services, and many others. It's our goal to meet people where they are by providing these comprehensive services to address their needs and priorities. Next slide, please. So then I wanted to go over the systems that touch people who use drugs. And this diagram provides, I'm really sorry, it's a little blurry, but it kind of goes, it says infectious disease programs, housing and economic development programs, Medicaid, FQHCs and hospitals, criminal justice systems, and the Bureau of Substance Abuse and Mental Health. And these are just some examples of systems that touch people who use drugs, and it provides a visual representation of the various systems that interact in some ways may impact the health of people who use drugs. And the diagram helps explain the complexity of addiction and the lived experience of people who use drugs. As you can see, there are a lot of interconnected systems that are in play, and as many of you may know. However, I feel like we may often lack a common understanding on the appropriate language or framework to address people who use drugs. So our goal is to have a common starting point, which is a drug user health framework by involving various stakeholders, various services, to provide a more unified effort and shared understanding of working with people who use drugs. And because of this goal, we have decided to expand the distribution of fentanyl test strips to OTPs and buprenorphine providers to further protect and impact the health and lives of those using. Next slide, please. So why OTPs? Just wanted to kind of give a brief, why are we doing this? Because we have since our evaluation last year, we have been providing fentanyl test strips to our overdose response programs, as well as our the nonprofits we work with and local health departments. So our goal is to increase the access to fentanyl test strips, to encourage overdose risk education and reduce the risk of death. They're proven to be an effective and practical tool for people who use drugs. And not only are they a tool, but they also are useful to initiate these conversations regarding the dangers of fentanyl, as well as to inform someone on actions or behaviors they can take to reduce their risk of overdose. So in this field, knowing that addiction is on a continuum and it's not linear, fentanyl test strips are another tool similar to naloxone to meet people where they are and to accomplish our overall goal of reducing substance-related morbidity and mortality to people who use drugs. So I want to hand it off. I think Mark has to switch the slideshow. I want to hand it off to MaHRTI. Like I said, she's from the Maryland Harm Reduction Training Institute. I can let her introduce herself as well, but she's going to provide you guys the training for fentanyl test strip use.
Hi, everyone. Can everyone hear me okay? My name is MaHRTI, and I am the coordinator for the Maryland Harm Reduction Training Institute from Behavioral Health System Baltimore. And I will be conducting your training today. So hope everyone's doing well. So if we can go to the next slide. Our learning objectives for this training will be to help you become more familiar with the basics of fentanyl and the benefits of testing, to develop some outreach messaging, to understand the role of naloxone in fentanyl test strip distribution and messaging. You should be able to understand the limitations of test strip distribution as an intervention, identify target populations for distribution and strategies to reach these populations, know how to use the fentanyl test strips, read the results, and be able to communicate this information effectively to others, and to be able to practice and develop an outreach pitch for in-person and outreach strategies. Okay. So next slide, our agenda. I'm going to do a brief overview of Maryland's epi and fentanyl basics when it comes to fentanyl in the state, talk about why we test for fentanyl, how to use fentanyl test strips as a tool for engagement, test strips, how to use them, and practice outreach techniques. And then at the end, there'll be some resources, and we'll have time for question and answers. Okay. Next slide. So what we can see here are the number of fentanyl-related deaths occurring in Maryland between 2010 and 2019. And what you can see with this chart is there was a steep incline from 2015 to 2016, and then steadily going up from there to 2019. And while you can see a huge jump from 15 to 16, an even larger jump is the 229% rapid increase between 2015 and 2016. But things have been steadily increasing since 2013. And so fentanyl-related deaths have increased substantially across the state and across the nation, amongst all age groups, amongst whites and blacks, men and women. 91% of heroin-related deaths in 2019 occurred in combination with fentanyl. 38% in combination with cocaine, and 14% in combination with alcohol. If you go to the next slide, you'll see that in Maryland by county, Baltimore City has the highest number of fentanyl-related deaths occurring in Maryland, followed by Baltimore County, Anne Arundel County, and the least amount of deaths reported in 2019 was Garrett County. If we go to the next slide, you can see that the number of prescription opioid related deaths from 2010 to 2019 has steadily been going up, with just a slight decline in 2019, but the Q1 2020 data that I've seen has actually showed that there is it's trending about the same. If we go to the next slide. So as we can see, in the number of cocaine-related deaths occurring in Maryland from 2010 to 2019, the statistics in red is showing in combination with opioids. So with the number of cocaine-related deaths in 2019 without a combination of opioids was 94. In combination with opioids was 775. In 2018, it was 792. So the reason why we wanted to show this is because you may hear from some of your clients or participants that they use stimulants such as cocaine, and so fentanyl test strips, that like they don't need to worry about fentanyl. And what we're seeing is that, you know, fentanyl has been, and opioid use and polydrug use is known to go on, and there has been some anecdotal data showing that that fentanyl has adulterated the supply of most of the drugs in Maryland, especially street opioids or pills. And so what you want to talk to people about is asking them, are they mixing drugs? Are the pills that they bought, are they getting the Xanax that they thought that they wanted? Or are they getting the powdered heroin that they thought that they wanted? Or did they know it was fentanyl? Were they looking for fentanyl? Which some people are. Unfortunately, the data doesn't tease out whether the cocaine that people had been using were what's called speedballing, which is an intentional mixture of cocaine and heroin, or cocaine and opioids, or if it was a contaminated supply. But it is important to know that just because someone is reported to be strictly a cocaine user, that they are still at risk for a fentanyl overdose. If we go to the next slide, you can see that the number of cocaine-related deaths occurring by county in Maryland in 2019, again, Baltimore City having the highest rate of deaths at 380 deaths in 2019, followed by Baltimore County and Anne Arundel County and Prince George's County. So I definitely think that information is of note. Okay, so yes, let's go to the next slide. And let's talk a little bit about fentanyl. So fentanyl is a synthetic opioid. And there are 3 classes of opioids, which are natural opiates, semi-synthetic opioids, and synthetic opioids. And opiates are pain-killing drugs. Naturally occurring opiates are from the opium resin of the opium poppy. Fentanyl, however, is fully synthetic, meaning it is derived from chemicals in a laboratory and has no natural opiate naturally occurring opiates in its makeup. It was introduced into the medical practice in the 60s for severe pain relief. It has been used has been used noticeably to relieving pain for cancer patients, and illegally manufactured fentanyl is being produced by drug trafficking organizations. It is easy and inexpensive to create, and has a good resale value for drug sellers. Let's go to the next slide. So, what we know about fentanyl. Pure fentanyl is extremely potent. It is about 100 times more potent than morphine, and about 30 to 40 times stronger than heroin. Again, 100 times more potent than morphine, 30 to 40 times stronger than heroin. It has a high lipid solubility, meaning it crosses your brain barrier faster, which means it hits faster, but it has a shorter duration, which means people need to use fentanyl more often. And the effects of fentanyl use is very similar to heroin. You get a euphoria, analgesia, which is pain killing, sedation, respiratory depression, nausea, and vomiting. And fentanyl has gone, traditionally, medical grade fentanyl has gone under several different names, such as Sublimase, Duralgesic. There's the Actique lollipop and the Fentora buccal tablets. And so there's also the Duralgesic transdermal patch that people may be familiar with. And all of these are quick acting. Okay, we go to the next slide. And then, sorry, next slide. Okay. So we test for fentanyl because we know that fentanyl has a very rapid onset. And it is so much stronger than heroin that it makes overdose very, very easy to experience. And so what we know is that with just like other opioids, naloxone is very effective in reversing fentanyl overdoses. So to respond to a fentanyl overdose, use the standard steps. You call 911, you give naloxone, you support breathing, you wait 1 to 3 minutes, and then administer a second dose of naloxone if there's been no response. And you do aftercare, which is staying with the person, waiting for first responders. If you have to leave someone's side, then you put them in the recovery position on their side. Naloxone is a life-saving medication that restores breathing. In the case of an opioid overdose, it only works for opioids. What's important to know about naloxone is that it takes about 2 to 3 minutes for naloxone to take effect, which 2 to 3 minutes in a panicky, life-threatening situation can seem like forever. And so you have a lot of people talking about they had to give someone, 4, 5, and 6, doses of naloxone. And many times that giving, multiple doses can happen for several reasons. One is that they thought they waited long enough between doses, but in their panic, they didn't, they weren't waiting the 2 to 3 minutes. Maybe they waited, 90 seconds, so on and so forth. Or it could be because there's polysubstance use going on. So maybe someone took opiates and benzodiazepines. Well, the naloxone would work with the opioids, but the benzos are still depressing the respiratory system. And so then the breathing becomes shallow once again. And so you start the process over again because naloxone only works on opioids. And one key tip that I'm sure that you've heard over and over again, but if you haven't, a key tip about rescue breathing when helping someone in an overdose is to do rescue breathing to the tune of the Bee Gees' Staying Alive. Think of it going, ah, 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 staying alive. Okay? So if you sing that in your head, you'll be golden. Okay. So the benefits of the fentanyl test strips for people who use drugs. So fentanyl test strips confirm whether fentanyl is present or absent in someone's street opioids, whether that person is actively interested in fentanyl or not, It can confirm if fentanyl is present or not in street non-opioids, such as benzos, cocaine, or crack. And what this does is it helps get a better understanding of the supply source, particularly if this is a drug seller that a person goes to regularly. It's a consistent source. And it's a good way to apply safety in a drug taking setting. It's a good way of harm reduction, because if you know whether the fentanyl is present or not, you can make options for yourself as to how you want to proceed, especially if you are buying a substance not intending for it to have fentanyl. Okay. So if we go to the next slide, some options for once you find out there's a presence of fentanyl in the drugs that were attained is you can use more slowly, or do a tester shot, is sometimes what we call it, and use a little and just wait to see how it takes effect. If you know how you're feeling about it. Trying not to use alone. Using with or near someone who has naloxone, which is definitely something that we should be constantly talking about and suggesting as an option. To tell someone or have someone check in on them when they know that they're going to use, especially if someone can't be with them. So maybe having someone, calling someone that they trust and saying, hey, I'm about to use, could you call and check on me, in 10 minutes, 5 minutes, come knock on my door, call me, text me. If I don't answer, come over, use your key, so on and so forth. Always having naloxone available and ensuring that others know how to use naloxone. If someone, purchases drugs from a source that has, and they find out that the drugs has fentanyl in it and it wasn't something that they were looking for, possibly trying to obtain drugs from another source. And last but not least, is simply do not use the drugs. In a harm reduction approach, you always want to have multiple options for people, because if you start or only give the don't use option, that may not be a realistic option for someone, especially if someone is, drug sick, and really, for whatever reason, needs to use. Don't use may not work for them. So we need to come up with consistent strategies that are valued options that will help someone in a situation when they've come in contact with fentanyl, whether the fentanyl use was intentional or unintentional. Okay. All right. So I want to pause here for a quick second when we talk about and start thinking about fentanyl test strips as a tool of engagement. So what I mean by that is when your agency or service provides fentanyl test strips to your clients, it is a way of saying, we value your life, we value your choices, we value your decisions, and we want you to be safe. If you are, regardless of whether you are looking for fentanyl or not, we want you to know what you're getting, and so that you can make a decision for yourself on how to proceed. We're not, it's really a way to say, we love you and we're concerned. Okay. So if you can go back, I think we went a little too far ahead. Yes, thank you. So messages, thinking about messages for people who use drugs. Again, as we saw from the data earlier, fentanyl is a large portion of the drug supply. So what we want to tell our folks is to learn to anticipate and to recognize fentanyl with or without the test strips. So people have reported that when there's fentanyl in their drugs or when they are actively seeking fentanyl, they have noticed a difference in taste and or possibly in color, or the sensation is different with fentanyl. So learning to know these signs when it comes to their drugs is really important, especially if they haven't if they've run out of fentanyl test strips or if they just haven't been able to access them yet, whether they just haven't had an opportunity or they have been hesitant. Noticing these differences is really important. To always have naloxone available and to ensure that others know where it is and how to use it. I have, talked to people who have like a little station set up in their bathroom with all of the naloxone that they've gotten. And it's just, everyone who comes over knows that the naloxone is in the bathroom just in case. Whether, the guests that come over are substance users or not. It's just out like hand soap. Always to discuss lower risk routes of ingestion, using less or going slow. So like I said earlier, doing tester shots, staggering use, not using all at one time. To definitely try to avoid using alone or having someone check on you. Okay. Do not wait to call 911 during an overdose. We'll talk a little bit, we'll mention a little bit about Maryland's Good Samaritan law and how it protects responders to an overdose, learning how to do rescue breathing, and talking to folks about how to connect with local harm reduction services. So many of you are instituting harm reduction practices in your current surroundings. And some folks are not able to. Having resources of other local harm reduction services available gives people more options, more availability to information, and gives some flexibility to folks that your agency may or may not be able to offer. And when I say that, I'm thinking more of treatment facilities may, have a no use policy. And if someone tends to use, having local harm reduction services as a safety net to, keep them, healthy until if and when they are ready to go back to treatment is a great way to continue saying that you care about their health and their well-being. Next slide, please. So the Good Samaritan law, and go back one to the Good Samaritan law. So one of the things that we mentioned is when someone is calling in to 911 to report an overdose, Maryland has the Good Samaritan law. So if you are reporting an overdose, you cannot be arrested, charged, or prosecuted for possession of a controlled or dangerous substance, possession or use of drug paraphernalia, or providing alcohol to minors. Calling 911 will not affect your parole or probation status. So many times, people are afraid to call 911 during an overdose because they are afraid of the consequences for themselves, because either they have drugs on them, they were using drugs with the person who has overdosed, and just general mistrust of the police system. And so what the Good Samaritan law does is it helps to protect someone who is trying to help someone else. It's not, we don't want calling 911 to be punitive for the witness nor the person experiencing the overdose, because we're trying to save lives. And so here you have lots of, here's like good posters that you could put up, and a more information about the Good Samaritan law is available. And these slides will be available at the end of the presentation. Next slide, please. Okay, again. Okay, so fentanyl test strips, they have a high accuracy and can detect small amounts of fentanyl in small samples to a high degree. So 0.13 micrograms or milliliters for fentanyl test strips can detect with about no less than 90% accuracy with just 0.13 micrograms. So the Rhode Island lab has a sensitivity of 96%, 100% in the Baltimore lab, 90% in, a specificity in 90% of the Rhode Island lab and 98% in the Baltimore lab. Okay. Next test. All right. So there are limitations. Even if the test results of the fentanyl test strip is negative, an overdose can still happen. There are always other risk factors that may be present. So some of the things that you want to talk about when you're discussing overdose prevention can be, mixing drugs, using alone, reduced tolerance. You want to do safety plans around all of these things. Reduced tolerance tends to come up after an illness or a release from incarceration, detox, or residential treatment. You want a safety plan around physical or mental health, or an unknown product, whether that's an unknown product from, like, they're trying something new, or they're trying their regular, but it seems a little different. Something seems just a little bit off. And so you want to think about all of these things when you're discussing overdose prevention plans with any of your clients. So, some more of the limitations of fentanyl test strips. It's an ever evolving, ever ongoing, imperfect science. You could have potentially diluted fentanyl or fentanyl analogs in your sample. There are potentials for false negatives and false positives. Or there could be undetected or emerging fentanyl offshoots or analogs that the test may not have been, when it was designed, these fentanyl analogs may not have been developed. Currently, you see the reactivity list in the box on this slide. These fentanyl and fentanyl analogs are all of the analogs that the fentanyl test strips test for. But the world is constantly changing, and there may be a new analog out that these tests are just not picking up at the moment. You know, science is moving fast. The people who make fentanyl are moving faster. And it's never changing game of catch up. Okay. So, how to use the test strips. Okay, so what you want to do is you want to get a sterile container to prepare your drugs. And with just the residue remaining, you want to add water, stir it around, and then let it stir well. That's when you're testing residue. If you're testing pills or powder, you want to crush and grind the pill and mix it well in your before you add it to the sterile container. If you're using powder, you want to mix it well as well. So you want to crush. Why you want to crush and mix the pills first is fentanyl tends to bind to itself. So in a pill form, it will do what's called chocolate chipping. So if you ever looked at a chocolate chip cookie, you'll see sometimes you'll get a big cluster of chocolate chips over here and nothing over here. It's the same way with fentanyl in a pill. When you crush the powders and mix it together, it distributes the fentanyl around more than it was in just the pill form, so that it makes it so that you are more likely, if there's fentanyl present, you are more likely to get it tested when you're doing the strip, as opposed to it just being centered in one little cluster. So for drugs other than methamphetamine or MDMA, you need about a teaspoon or 10 drops if you're using the little ampule, such as seen in the diagram. Okay, next slide, please. So step 2, once you have your residue mixed in your container with water, you want to hold the blue end of your test strip and dip it into the water for about 15 seconds. And only dip up to the wavy lines. Then you want to wait 2 minutes, and then you'll see the lines show up in the middle in the test area, which in a minute I'll show you, I'll give you a better close-up. When you're testing for methamphetamines and MDMA for fentanyl, the composition of those substances may trigger false positives if too high of a concentration is tested. So if too much of the methamphetamine or MDMA is tested, it may give you a false positive. So to adjust for that, for MDMA and methamphetamine only, you want to add approximately a half a cup of water when testing. And test the methamphetamine residue only. You don't need to do full or partial shards. Okay. So when you're interpreting the test results, very similar in ways to pregnancy tests, except for the new ones that say the words outright. You have, for a positive result, you get one red line in the center. If you see 2 red lines, that means the test is negative for fentanyl. Please know that the second line may be very faint, but as long as the line is there, as long as there are 2 lines, it is negative. And if on the rare occasion you get no lines or no control line, that means that the test is invalid. And if you have another strip, you would want to retest. Okay, so again, in the test area, if you have one red line, that means your sample has tested positive for fentanyl. And if you have two red lines, your sample has tested negative for fentanyl. And if you can go to the next slide. Okay, so here's a better, closer picture of what I was saying. So your test area is right there in the middle, and above you can see a positive for fentanyl test results. So you have one bright red line, and then at the bottom you see a negative test result in the test area, and you see two lines. That second line where the arrow is pointing, even though it's fainter, as you can see, it still is read as a negative result. Okay. All right. So this is the actual instructions that come with the fentanyl test strips in the packages. And so it gives you all of the information and the waiting times that I have given you. And so again, you just want to make sure that when you're talking to your people about using fentanyl test strips, let them know that this information will be there, but you're just reiterating before they go off on their own. Okay. All right. I want to pause to see if there are any questions thus far. If there are no questions, we can go to the next slide. Next slide. Okay, there we go. Yeah. So I want you all to take a moment to think about, in your current workspace, working with your participants and clients, how would you message fentanyl test strips? How would you get the word out and try to get them on board? Oh, I do see one question. Okay. Marianne, during COVID, asked, during COVID, are we still teaching rescue breathing? We are still encouraging rescue breathing. We realize that COVID is a barrier. The issue with that, the understanding is that with opiate overdose, breathing is the most important way to keep a person alive. And so we're asking folks to use their best judgment, but knowing that rescue breathing is the best way to keep someone alive in an opiate overdose. And yes. Okay. So thinking about your work setting, how would someone like to tell me how they feel like they would best message using fentanyl test strips in their workspace? Okay. Marianne said that her message would be that this is important that you understand what drug you are using, so testing is important to be safe. Excellent. Thank you. Who else would like to give an example of how they would message using fentanyl test strips? And you can either use the chat or you can unmute yourself and address the group. So some of the ways that I message fentanyl test strips is that when you are talking to someone who is a substance user, you want to say that knowing your supply and knowing what you have is important, because A, you want to know, did you get what you paid for? If you were looking for heroin, strictly heroin, did you just get that? Or did you get fentanyl? Because by knowing that there's fentanyl in your supply, again, we talk about how the options that you could use, going slower, using a tester shot, making sure someone is aware that you are using. It gives you more options in case something possibly could go wrong. Let's see, in the chat, it looks like we have facilitate an educational group regarding the importance of fentanyl testing. And that was from Lorena. Keith said the dealers will cheat to gain more business and more money. Using these strips will help keep them honest and keep you safe. Good to know. That's a good one. Let's see. Joyce says, in the area where we work and our clients, most of the drugs that have come through on the streets are laced with something, usually opioids. It's better and safer to test than to run the risk of dying from something laced with opioids when you didn't want them to begin with. Agreed. The flip side to Keith's comment is, anecdotally, I've heard that some dealers are using fentanyl test strips as a way to offer proof of purchase. So yes, I can see your face. So, it is also a way for them to retain their clients. So those who are strictly wanting one type of opioid, non-fentanyl opioid, are saying, a drug seller will say, here, before you go, test it. Make sure, we're both on the same page. You wanted heroin, here's heroin, there's no fentanyl in it, so on and so forth. That way it builds trust between the drug seller and the user, so that it creates a relationship, or strengthens the relationship, so that they know that they're both on the same page, is what I'm saying. I'm sorry. But it's a very interesting, I thought the same, I've heard both sides of the coin, and I had your exact same reaction. I saw your reaction, Keith, and I said, wait, what? They're doing what now? Yes, the drug seller Better Business Bureau. But what you want to stress to your clients and to your participants is that testing your drugs is one of the more important ways that you can help to keep yourself safe and exercise your options. It is a very simple message from you as an agency or organization to your clients or participants, however you call them, to let them know that you value their life and that you want them to stay alive and you want to help them make the best choices for them. And this is one great way to do so. In the list of the arsenal that you have into helping them and to keeping them here and keeping them alive. This is just one more tool in the toolbox that they can use and that you can use. And I also wanted to point out from one of our participants that with the rescue breathing, it's slower than the beat of staying alive, but it helps with your counting for your breaths. So thank you for that tip. Okay. So is there anyone else who would like to give an example of how they would message the fentanyl test strips? So if we could go on to the next slide. So here we have a list of resources that you may find helpful to keep on hand for yourself and your participants. There we go. Allison has just put another resource in the chat box for you all as well. The naloxone request form is also available there. Okay. And are there any final questions for either myself or for the Center for Harm Reduction Services? And they can be done either via, oh yes, there, you will receive the slides afterwards. You're welcome.
So I also know that I know Keith had kind of checked in some of his coworkers through the chat box, but I just wanted to make sure that anyone who was joining by phone checked in verbally, just to make sure that you obtain can request the CEUs. So if anybody wants to unmute themselves over the phone and give us your name and the type of CEUs that you would be requesting, now would be a good time. I think, Keith, I have Reginald Cooper, Walter Thompson, Brandon King. And those, you said they were logged in by phone. So if anybody else is logged on through the phone.
And Allison, it looks like we have a question for you about getting naloxone for patients.
So that form that I just posted, that is the most current, that is still active for OTPs. I'm not exactly sure what OBOT is, so forgive me, because I did just start in July, so maybe that's just something I'm not familiar with. But OTPs and buprenorphine providers can request naloxone through that app. And I did want to say that the fentanyl test strips were shipped out Friday. We had hoped to have them to you prior to this training, but that obviously just the limited access to the building, it didn't happen. So you should be getting those hopefully sometime this week. And if you have any questions upon receiving the strips, please let us know. You can reach out to myself, Mark, Mira, and we'd be happy to help you. And also, I encourage you to go request naloxone through that form so that you can, that can be also part of the conversation.
Do we have any other questions for anyone? No? Well, again, thank you all so much for attending the webinar today. It was a pleasure being in community with you all. And thanks to Mira for such a lovely presentation. And Allison, thank you so much for facilitating. You all be sure to look out for a follow-up email that will consist of the presentation, the recorded call, as well as a few resources from us here at the center. So thank you all so much. Have a beautiful day.
Thank you all.
Thank you.
What's your phone again?